The Forum of Chief Executive Officers of State Social Health Insurance Agencies (SSHIAs) have re-elected Dr. Simeon, Onyemaechi, Managing Director of the Anambra State Health Insurance Agency, as chairman for another 2-year term. The election at the forum's second quarterly meeting held in Lagos is seen as a decisive move to consolidate progress towards universal health coverage (UHC) in Nigeria. The forum, which attracted CEOs of state health insurance agencies from across Nigeria, featured discussions on expanding coverage and addressing critical challenges, ended in the election of new executives who will steer the forum until 2027. Dr. Onyemeachi, in his acceptance address, reaffirmed the forum's commitment to improving health insurance penetration across Nigeria. He called for peer learning and interstate collaboration. The new CEO said universal health coverage is attainable through two key strategies: social health insurance that leaves no one behind and a strong primary healthcare system.
Nigeria as a country, we have chosen for ourselves a pathway to attainment of universal health coverage. And the two strategic pathways that we have identified as a country are the part of social health insurance that will leave no one behind, and an effective primary health care delivery system. With those twin strategies, Nigeria hopes to attain universal health coverage in line with the Sustainable Development Goals 3 Target 8. Now, for every state of Nigeria to get to the point where we all have attained UHC, there was a need for a robust engagement, a peer learning mechanism across our states. Because if there are certain states that are doing very well, while others are not doing so well, at the end of 2030, which is the set year for determining what countries of the world have attained UHC, Nigeria will not have been included in that number. But for now, we didn't have every state having a functional health insurance scheme, but today every state government of Nigeria have set up a functional state health insurance scheme that is reaching out in our local languages across our various rural communities, such that the component of equity, which is critical, that no one is left behind, is being infused. And today, across every nook and cranny, the message of social health insurance and the need for our people to come on board by paying little premium, which are highly subsidized by our various state governments, has really come very, very much alive across Nigeria today.
The head of the Electoral Committee and CEO of the Kebbi State Health Insurance Agency, Dr. Jafar Mohammed, commended the forum's transparency and maturity during the electoral process. He confirmed that each new executive was elected through a free and fair process in line with the forum's constitution.
Is to see that the state social health insurance agencies across Nigeria, from the 36 states and FCT Abuja, are doing well in trying to achieve universal health coverage across the country in line with the extant laws, the NHI Act 2022 and the respective laws of social health insurance schemes across the 36 states. And hopefully Abuja will have its law soon also. So this is the main objective of this forum, and as you can see, the forum has its own constitution by which we have to hold elections every 2 years to bring in ESCOs that will lead the affairs of the forum. So we have just conducted a free and fair election in which ESCO members were elected into offices.
The Publicity Secretary of the Forum and Permanent Secretary, Lagos State Health Management Agency, LASHMA, Dr. Emmanuela Zamba, emphasized the inclusivity of social health insurance, especially for the informal sector, SMEs, and vulnerable populations. She said that Lagos alone has recorded an additional 6% in health insurance coverage within 7 years of establishing health insurance agency.
Social health insurance is inclusive. And of course, what we are supposed to be doing as each and every one of us have an agency in our state is to ensure that we concentrate on those people that are uncovered and we bring them into the pool. So our premiums are affordable, we have a robust benefit package, and it is something that we are able to show credibility and ensure that whether you are in the informal sector, whether you are an SME, you can come on board and you are assured of your health insurance. Of course, if you are vulnerable, most of us have equity fund. There is also the federal government fund, which is called the Basic Healthcare Provision Fund, that is sent to each state to be able to enroll the vulnerables that they have in those states. So in the last 7 years, as the chairman had pointed out, we have grown the health insurance coverage in Lagos State by an additional 6% simply by our existence. And the sky is the limit. As of course, now that there's an NHIA Act that makes social health insurance compulsory across Nigeria, wherever you live, you must key into the social health insurance of your state. We are guaranteed that as we move along, we will be able to bring in even more and expand health insurance coverage as quickly and efficiently as possible.
Access on the four reports that the Forum of CEOs of SSHIAs established to promote fair learning and collaboration among state agencies has become a pivotal platform for driving health insurance uptake in Nigeria. The forum also supports innovations, policy alignment, and equitable access to health services for all Nigerians.